Hello, Dr. Eva Fisher here with part 4 of my recovery story of how I recovered from body dysmorphic disorder, also known as BDD. When I last left, I had really wrestled with, well, I was very relieved actually to be able to self-diagnose myself with body dysmorphic disorder. As strange as it seems to say that, I mean, it was still hard. It was very hard to really, for the first time in my life, understand that I had a mental health disorder. However, it was also a relief to know that I had a diagnosable mental health disorder that could be treated with medication and with therapy. Before that, I had lived from the time I was 16 to the time I self-diagnosed myself at 30, convinced that I was ugly, that I was disfigured, that my nose was just fat and ugly, even after I had had a rhinoplasty, which is plastic surgery to make my nose look slimmer and better. I still disliked how my nose looked, and I still disliked how my face looked. I will say that as an artist and as someone whose parents were both artists, it was also very shocking to me to realize that what I was seeing in the mirror wasn't really what others were seeing, that I was seeing a distorted image of myself. And that was very hard because as an artist, I really wanted to, my eyes mean everything. What I see is really important to me. And understanding that what I was seeing wasn't accurate, was distorted, though it was a relief to me to realize that I wasn't as ugly as, or I wasn't probably ugly at all. However, the fact that the mirror was lying to me was really hard for me to understand. And I really had to learn more about the disorder before I would really understand how and why the neurobiology of the disorder causes people to see themselves as disfigured when other people do not. But let me continue with how I was treated and the treatment I received for my BDD. So the psychiatrist, I referred myself for treatment to my HMO, health maintenance organization, that I was a part of at the time. And one thing that was interesting when I was talking about my recovery story in my book, The BDD Family, I realized that even though I self-diagnosed myself in 1997, I was I had a part-time job, which meant I didn't have health insurance at the time. So I actually waited until 2000 to when I had a full-time job as a website designer, actually. And then I was able to get on health insurance. I was part of a HMO, and then is when I referred myself to treatment, was when it was covered by insurance. So I do want to mention that because I know one of the barriers that people have for getting treatment is not having health insurance. And I know that can be a barrier. So, however, I waited from the time I self-diagnosed myself in 1997 to 2000 to actually then refer myself to treatment. And I referred myself, Kaiser assigned me both a psychiatrist, is the person who prescribes medication, as well as a psychologist, which is what I think many people think about, which is more of a therapist, the person you kind of talk to or who, helps you in terms of, weekly sessions. So the psychiatrist at the HMO, she was not familiar with BDD, and so she diagnosed me with depression. And because I had depression and anxiety along or because of the BDD, then that was also an accurate diagnosis. She agreed to put me on Prozac, which fortunately is one of the medications shown to reduce symptoms of the disorder, along with other SSRIs, which include Zoloft and others that help. They're called selective serotonin reuptake inhibitors, and they're actually a type of antidepressive medicine. I also entered therapy with a clinical psychologist, and I was actually doing talk therapy because, again, I was diagnosed with depression, and talk therapy is a treatment for people with depression. The medication started to take effect after a few weeks, and my anxiety and preoccupation with my appearance slowly started to diminish. My mother was the first one to notice the change in my demeanor. She was delighted to see me smile and told me that I was becoming the young woman she always imagined that I could be. Unfortunately, my mother passed away after battling breast cancer for 8 years. She unfortunately lost her battle with breast cancer when I was 34 years old, which is again shortly after I started. I was able to start recovering from BDD enough so that my mood lifted and I was able to actually look people in the eye, and I was actually able to feel happy for probably the first time since I remember, since I was really 13 years old and spending time outside in nature and with my friends when I was a child. So it was a long time. It took a long time for me to recover. And unfortunately, I am glad that my mom was able, although she never knew that I had body dysmorphic disorder, I'm very glad that she was actually able to see, the positive effects of both the therapy and the Prozac. And so I'm going to come back with a little addendum to my recovery story on the International OCD Foundation site before I wrap up. So come back for part 5 when I talk a little bit about kind of moving beyond getting over my BDD symptoms with medication and therapy. Thank you.